Let's move on to Nurse Williams. And tell me your opinions about Nurse Williams, please. Let's start with the first one. You mentioned that her conduct fell below the standard of care. The nurses, for failure to assess vitals.
Correct.
Can you tell us why we pull that in?
Well, because, when you've got a patient who's seen in triage, that triage nurse is getting as much information as they can in a timely manner. When you've got a patient who comes back to one of your rooms that you're responsible for, you want to try to get as much information as you possibly can, because one thing that we find in the medical field, it's kind of like that old game where you've got 6-8 people come in and tell a story. By the time that it gets to the last person, it gets extremely diluted. We run across the same thing. So we talk to the patient. We want to reassess what's going on. Hopefully we'll get some more information that maybe wasn't elicited in triage. So we want to try to get that information. One of the things, again, that's my criticism of Nurse Williams is that she did not question the blood pressure at all as well.
How do you know that?
I see nothing documented in the charts that I'm looking at, nor in her deposition.
Well, we've heard testimony that even though it's not charted, her habit and custom is to do everything right. Is to chart this and chart that. First of all, let me ask you, is your habit and custom to chart what is medically important for patient safety in the chart?
Absolutely. You want to document everything you can about the patient interaction, all your experiences, all conversations that you have with physicians, nurse practitioners, surgeons, things like that. You want to document that.
Have you been trained in your nursing career that if you don't document it, you haven't done it?
That's basically correct. That's the mindset.
Did you see anything in the chart documenting whether Nurse Williams ever did an assessment of Janice's hypertension, extreme hypertension?
I did not see anything at all.
What about assessment? Now, at some point, Jan, of course, it's reported that she was requesting medication for her headache, which was rated as an 8 out of 10. Did you see that in the record?
Yes, sir. Yes, sir. I'm going to that right as we speak.
Do you have any criticism of Ms. Williams for how she responded to Jan's request for medication for her headache?
Yeah, it looks like the entry that's timed 2306, 2307, that Trina Williams requested medication for a headache, says Dr. Sutton is aware. My criticism of her is that she noted the headache. Again, this is a new complaint. This needed to be assessed just like the blood pressure did. Questions such as, how long have you had the headache? Did it just start? Have you had it for how long? Where is the headache? Do you have a history of headaches? Is it very similar to previous headaches that you've had? Did you fall down, hit your head? Is trauma being a possible cause? So there's a number of things you want to ask about this and assess in regards to the headache, which she did not.
Does the standard of care require a nurse to assess a headache in the way you described in the face of a patient who has extreme hypertension and nausea and vomiting?
Yes, sir.
Okay. And when you review the records and the depositions, did you see any indication that Nurse Williams did such an assessment as the standard of care requires?
No, sir.
And do you believe her failure to assess Jan's vital signs, her new headache, as far as the record is concerned,
Yes, sir.
Is a departure from the standard of care?
Yes, sir, absolutely.
Do you believe it's a gross departure from the standard?
Yes, it is.